The aim of this video is to clarify that early surgical intervention in cases of anterior type PHPV is helpful cosmetically and functionally to the patient. And also, whatever the age of the patient of unilateral cases, intraocular lens implantation is very essential because unilateral aphakia is as strong a stimulant for amblyopia as the opacity itself. In this video, I displayed the case of 10 days aged infant with unilateral anterior type PHPV, underwent limbal lensectomy, anterior vitrectomy, and also intraocular lens implantation. As you see, paracentesis is done infratemporally using super sharp blade or micro vitreoretinal knife to apply anterior chamber maintainer. Trying to do capsulotomy with a cystotome, however, at that age the capsule is so tight and not easy to be torn, so it's completed by the vitreous cutter. Hydrosection is done to facilitate the aspiration of lens matter. By the vitreous cutter, using the vacuum only, we can aspirate the lens matter. It's so easy to aspirate it because the lens is very soft. We can see the ciliary process extended and stretched to the equator of the crystalline lens. Now, the vascularized posterior capsule is exposed, and before opening this layer we need to cauterize it in order to make the field bloodless. By microvitreoretinal knife we can make a cut in the posterior capsule to be completed by the vitreous cutter. We can see the remnant of the hyaloid canal and its vessels floating in the vitreous cavity. Sometimes we need to cauterize it if the risk of the vitreous bleeding is expected. Anterior vitrectomy is done. Now the intraocular lens is implanted in the sulcus. We can implant either a big or foldable IOL. The child now is 1.5 years with cosmetically and functionally well-being eye. We can conclude that PHPV eyes have a potential for developing useful vision with favorable cosmetic outcome after surgery. Whatever the age of the patient, IOL implantation is a favorable and helpful option for the management of PHPV. Thank you.